were deemed to have a disability that was too significant to benefit from VR services. So that was only about 2% of the data set were found ineligible because they were too severe. And that's a contrast to what we hear from people in the community who often tell us that they couldn't even get their foot in the door to VR because they were found ineligible right off the bat. So that's an important question to track as we go forward. In the VR data set, similar to our other outcomes data sets, there's not a lot of information about impairment severity of people, so we don't know their IQ or we don't know their conversational impairments, but it can be useful to look at supported employment because you have to have the most significant level of disability in order to access supported employment. And we find that about 1/3 of the workers with autism had supported employment or on the job supports when they left VR. Look at the types of jobs that people with autism had. About 3/4 of the group fell within the top 5 to 6 jobs that were possible to have. The most common job type was office and administration support, and nearly 1/4 of the group with autism worked in those types of jobs. So the job types are mostly similar across VR users with autism, whether they required supported employment or not. However, there were some differences. Those that were in supported employment were more likely to work in food preparation, and more had jobs in building and grounds cleaning and maintenance type positions. A little bit of context before I share this data. So for the year 2014, for all employees in the U.S., about 19% worked part-time, and $240 per week was their median weekly wage. And when we look at the autism group, we find that about 80% worked part-time and that their median weekly income was $160. So when you calculate that out across a year, what you find is that the bulk of people that are with autism that are receiving VR services are becoming employed but then having jobs that place them below the federal poverty level. When we look specifically and we think about people that are employed with supports or without supports, those that are employed without supports, about 76% again are working part-time for about $170 per week. And those who are employed with supports, about 90% of those are working part-time for median wages of $145 per week. And again, WIOA really focuses on trying to bring up that wage level and producing sustainable wages for people. So how do outcomes and services compare across groups and across states? I told you that about 3% of the people in the VR data set have autism, about 9% have intellectual disabilities, which is one of our comparison groups. We look across groups, we find that those with autism receive services at a similar rate to those with intellectual disabilities and only a slightly higher rate than those with other types of disabilities. We find that the average expenditures on total services per person with autism were nearly 20% higher than the group of people with intellectual disabilities. The expenditure was closer to that for people with all other types of disabilities. And we know that supported employment are the most costly types of services. Those tend to cost about 2 to 4 times more than any other services. But when we looked more closely, it wasn't that the autism group received supported employment more often than other groups. We really don't have an explanation currently for why this group would cost more. And then also VR service users with autism exited with a rate of employment that was similar to those with intellectual disabilities and other types of disabilities. We also found that their rate of working part-time and their median wages were also similar across all the groups. So in this data set, at least for this year, and at the national level, it did not appear that the autism group was faring worse. But hold that thought for just a moment. So when we look specifically at supported employment, people with autism received supported employment less often than those with intellectual disabilities and of course, those with all other types of disabilities. So there was little variation compared to peers, but the story really shows up in where you live. The state-level data is really where the message is. So VR outcomes vary dramatically across states, as I'm about to show you. And nearly every state has different types of policy, different legislation, and different activities that are focused on implementing employment-first systems change and will be focused on implementing WIOA. So as state plans roll out, we expect that this level of variation will probably increase across states. So we looked at the 50 states in the District of Columbia and broke down the autism data by state. It's also important to know, though, that we did not have data for some states. There were several that either didn't report it or we're not sure why the data wasn't there. We chose to go ahead and analyze the data as it was, as states reported it, but obviously this can affect some of our findings. So how many eligible applicants with autism received services? This number varied by about 50 percentage points across states. And then similarly, the number with autism who exited VR and went on to employment, again, varied by about 50%. We also calculated what we call the autism wage gap. So we looked at all wage earners in the state and what their earnings were, and we compared that to people with autism who were employed without supports. And when we look at this, we find that the gap between most wage earners in the state and those with autism varied quite dramatically, from almost $23 an hour in the District of Columbia to about $6 in West Virginia, but an average of about $8. I'm going to talk to you about some of the limitations to this data. So we covered that there are no reliable measures of impairment severity in this data set, and there likely are inconsistencies in data collection and entry across states. We have no direct reporting from service users with autism, and we don't have any information about people who do not receive VR services or who exit before they have a job. In terms of research priorities, this type of descriptive data that we produce is really laying the foundation for where we're going to go next with all of our outcomes research, but it's particularly true with this data set and with Social Security data. So we would like to understand more about service use patterns, about people who churn is a term used in Medicaid research. And similarly, we think that people churn in and out of VR services, where they may receive a job with VR help, be employed on their own for a while, but then possibly lose that job, have to go back into VR, and then simultaneously are probably rotating in and out of public benefits like Social Security income. So we're very interested in that. And then the state and local level variation is another area that we would like to explore next in our seeking funding, because we would like to know what are the significant factors that are modifiable across states that we could start to impact through policy and services that would help to identify model states as we go forward so that we can replicate the programs that they're using. And we think this is a really important question, so we're going to be starting to track those via with state plans. And that's the end of my presentation. I'm happy to take questions. John?
As someone who operates a high school and a post-high school training program for autistic people back in Massachusetts, one thing I observe about your comment about why people drop out of VR, in Massachusetts, the VR programs are limited to 6 and 8 weeks for most people, and I see situations where, especially people with mild or moderate intellectual disabilities and autism come into the program, and they talk to counselors, and it's like, what, 6 weeks, you're going to teach me to be X or Y or Z? And it simply isn't realistic. And people opt out because the training that's offered isn't going to work. And so you think, well, what if they go through it anyway and try it? And I have some of those people employed in our complex, and we're part of that group that's employing people part-time, and they don't make living wages, and it's because there isn't state funding to teach the people skills that would qualify them for full-time jobs. And I think that is a real tragedy. And I wonder, what can we do to address that? The idea that a 6 or 8 week program is going to take many of these folks and turn them into productive lifetime workers, it's just not real.
Absolutely, and I agree. I think that's why WIOA attempts to address that, at least in providing longer-term services to youth. I think it's also important that we look at outcomes from Project Search type programs and Project Search Adapted for Autism, that is providing services for longer and more intensely in a more focused manner, but also are facilitating that collaboration between VR, Department of Ed, Department of DD, and getting all the players to the table, because we know collaboration works.
Project Search has been great here, like when I've seen it shown at NIH, but how do we make Project Search work nationwide? Is there a model for that?
I don't believe that there's a nationwide model. There are similarities, and it is certainly administered by one person, one set of people who are trying to keep fidelity to that model across states. But I think the research that's coming out on it shows that it merits, obviously, further consideration. Allison?
So you showed data for people with autism and then people with intellectual disabilities. How are you including people with autism and intellectual disabilities?
We actually separate them out. So when we look at group-level comparisons, we're looking at people who have autism as their primary or secondary cause of impairment, and that means that the VR counselor said that autism was the cause of their impairment. When we talk about group differences, though, we do not include people that have both autism and intellectual disability co-occurring. We look at those groups separately, realizing, of course, that a lot of times it does co-occur.
So what happens to those people who have both? How are they tracked?
I assume that you can look at them in the data sets and look at people who have co-occurring disabilities. It's not a clean data set because even we talked before about clinical verification of diagnosis. There's obviously no way to verify not only that, but this is data that's entered by someone who made a judgment that this person does or does not have autism and that is the primary cause of impairment as compared to intellectual disability. We simply don't know.
But they are included in this program?
They are. Oh, absolutely, they are included. Yeah, when we talk about how one group is doing versus another group, it's important to us in outcomes research that we separate out groups as cleanly as we can, knowing that they do share a lot of characteristics.
So when I think it was 31% or 30% of the people whose VR cases were closed were receiving supported employment. And I don't understand the system at all, but what happens to their supports when their case is closed?
That is an excellent question. So when you have supported employment, you needed a significant level of supports to get a job and maintain that job, and then you have that job for 90 days. At the end of that 90 days, or sometimes a little bit longer than that if it's written into their plan, they discontinue receiving those services from VR. So VR does not administer those services or fund those services. However, they may be picked up by a community rehabilitation agency. So they still can continue to receive services. We don't know how many people do continue or perhaps return back to VR and sort of start the process all over. We also don't know what happens to those people after they exit VR and then are transferred to another provider because the data collection stops. And this is the problem, again, with trying to look at employment through developmental disabilities is we don't have the same rigid level of data collection like we do with the RSA data.
The last question, then we need to be done.
I just wanted to add that Medicaid's Home and Community-Based Services program also often funds supported employment, and there's some interesting demonstration programs that would sort of blend and braid those funding streams so that VR will cover the service and then it seamlessly transitions to being covered by Medicaid's Home and Community-Based Service. So those are going to be interesting, but I don't think that they would be covered by that data set, unfortunately.
Fortunately, though, we can link some of these data sets, and so we're currently trying to get access to the Social Security Administration data so that we can look at the VR data, SSA data, and hopefully some Medicaid data, and hopefully tell a more complete story about what's happening to people across time. But again, this is a plea for longitudinal study funding. That it's really important that outside of what's being asked to people and entered into these data sets administratively, that we really need a means to follow people and tell their story over time outside of some of these systems.
And I have a question for you related to our strategic plan update. Are there any particular limitations in data sets that you noticed that we should take into account when thinking about question 7 on strategic plan?
I think that the million-dollar question that people always ask us is to break down the information by severity level. It's such a heterogeneous population, as everyone at this table knows, and it's important for us to be able to